Hello, this is Mark L. White, and I'm here with my friend Dr. Dan Larke. Dan Larke is the author of The Man Plan, the ultimate guide to ED and rockstar erections. Which I guess my first question is, define rockstar erection.
Great question. And Mark, thanks for having me here today. We hear all the time, like rock stars have these crazy, sex appetites, and they have the ability to go. And so that's what I'm trying to give the some hope that we can get back to our youth and, having, great erectile function again.
And you're also a provider. You're in Arizona. You specialize, you have the Thrive Regenerative Medicine, specializing primarily in men's health.
Correct.
And you're an MD, a DO, naturopath.
Naturopathic physician, exactly. Yeah.
It's cool that they have those. Like, I'm on the East Coast and they don't know what naturopaths are. And I love like the West Coast, like naturopaths, you guys believe in fixing the root cause of things.
That's what it's all about. And, that's one of the reasons why I wrote the book was, there's a lot of things out there that can just put a Band-Aid on things like, Viagra, Cialis, even Trimix. But Gainswave is the first thing that's come along where we have hope for our patients to get to the root cause. Of course, the root cause of eliminating some plaque and growing new vessels, but and also in working with, and that's what my goal is to work with them to eliminate what the true root cause, which is going to be usually inflammatory conditions, hypertension, diabetes, and things like that can cause the problem.
So at Thrive, when did you, how long have you been practicing regenerative or integrative medicine?
So I have been practicing for 12 years. I'll give you a little background. I'm out of school. I went to work for a men's wellness clinic here in the Phoenix area, and primarily erectile dysfunction and hormone therapy. So I got to be, I threw myself into it and became what I would consider an expert on men's hormones, every aspect of that. And at the time, the clinic I was working for was primarily just, PD5 inhibitors and Trimix. And I felt that actually early on, I saw this product coming out, and I tried to talk to the person who ran the clinic about incorporating it. And it fell upon deaf ears. So I left, and I felt like now I have my hands free and clear. I can do what I want to do, and everything I've done since then, which is I got into PRP back in probably 2012. Working with joints, and then ultimately with the P-shot, working with Dr. Runnels, training with him, and then finally incorporating it, into so working with Peyronie's disease, erectile dysfunction, joints, sports injuries, all that sort of thing. So I cover the gambit on that, but men's sexual wellness is really my forte.
So when you think of, it seems like when you think of guys wanting to get on any program, it always starts with a penis. It's like we have another brain down there.
Yes. I touched on this in my book, and, when I was doing research for the book, you realize that when we are, let's say, start dating, and we're getting with a woman, the sexual compatibility is huge, right? At least 50%, right? Do we get along? And yet are we sexually compatible? And then when you really break down, and as I was researching the book, the average, and this is a study I think that came out of Europe, the average man might last 5 to 10 minutes before orgasm, right? Now we like to think we can go all night, but in reality, is the average person just doesn't last that long. Throw in foreplay, yes, it lasts longer. But when you really break down, the average man might have sex a couple times a week. So make that 8 times, let's say 10 times a month. So let's say 10 minutes. So 10, that's 100 minutes a month. So 100
2 hours a month of having sex.
Exactly. And then multiply that times a year, and the amount of time in a day, the amount of hours in a year, it's such a small fraction, but it is a huge impact on our relationship and our life when it doesn't work when we want it to. And so, yeah, it is there. Guys will just literally, they'll do anything to get that something back. One of the other things that I found is that I'll get older gentlemen, they'll be married for 40 years plus, and they'll come in and they'll say, my wife, it's not functioning as well. I told my wife I'm going to go see a specialist, and she's like, honey, we've had a great long run. You've been married
We've had
for
a great
years.
long run.
we've been married for years. We've had some great sexual activity, but I love you and I'm okay with things. And the men come to me and I'm not okay with that. Being able to get an erection and perform sexually is part of our DNA. It's part of who we are. And even if my wife or my significant other has no interest, I need to do this for myself. And I see this more often than you would imagine.
So what percentage of the guys that come see you, are they usually coming to see you for erectile issues, or are they coming for something else? And then you get into that.
I would say a good portion of the guys that come to me here recently are hormone issues. It's the classic, right? Because it's out there everywhere. Is your libido low? Do you have low energy? And so that usually turns on the light bulb in the brain, like, oh, holy cow, I need to get my hormones checked if I'm in my 40s beyond, to find out if that's the cause of my low energy, low muscle mass, and all that. And then again, a good portion of them, while they're in, they'll open up to talking about maybe not having the erectile function that they used to, and we can get into that. And then there's a good portion, guys who just literally are here for just ED.
What would you say? Like, I know when a lot of guys are searching for it, sometimes it's psychological. How do you know, like, how you can help a guy? Like, how do you know if it's psychological versus hormonal versus physiological?
It's a great question. And that's where, and again, I talk about this in my book, is it's a thorough intake, right? We have these tools at our hand, and that we can, quote, sell them. But really, if you're really interested in getting to the root cause, it requires a good amount of time in the clinic of drilling down and finding out, okay. And a lot of times it doesn't happen until later on, when guys, it's an incredibly sensitive subject, and guys aren't necessarily willing to open up. They're guarded when they come in. They've got this male alpha thing going on, and it's very difficult for them to talk about. But how is, everything from, what impacts the psychological end is work. Stressors is such a huge part. And a lot of guys are like, no, my stress is fine. And then you start talking about drilling down how work is, and the fact that their inability to get an erection has affected their home life. So stress plays, the sympathetic nervous system plays a huge role in this whole thing. So it's just asking the right questions and spending enough time that you can, drill down to get that information. But about every aspect, financial, what's going on with their relationship, what's going on with work, and then putting the big picture together. And then the big thing is that doing testing. First of all, can they get any semblance of an erection at all? How firm is it? What works? Viagra, Cialis, do they work at all? And then you basically can narrow it down. And a lot of it can be psychosomatic. It's performance anxiety. I'll give you an example of one. It was really interesting. Is this young? He was in his 20s and he came in. First marriage. He had never had sex before. He'd been saving himself. And they finally get married, and he can't perform. And
poor guy.
There was so much anxiety going on with this whole thing, and she was a virgin also, which is crazy. But so I said, here's what you need. We need to relax. We need to do. Bottom line is, I didn't see him for a while. He came back. We did a follow-up. They went on a cruise, and on the cruise, it was amazing. Everything worked perfectly, because they had left all of their, basically stressors back at home. They were on a cruise, everything chilled out, and everything started working again. So Yeah, that can be a factor.
So once he learned how to relax, he can get he stopped overthinking about it.
Exactly. Well, we know when we're in fight or flight, the
Mhm.
body, I call it, the brain has circuit breakers that prioritize which body functions it's going to allow you to use, right? When we're in fight or flight, reproduction is not a prime to our survival. And so it shuts off the nerve impulses to the erections, and we get vasoconstriction of our peripheral vessels. That's why we get cold hands and cold feet when we're nervous. And it closes up the vessels to our periphery, and it makes it incredibly difficult to get an erection when we're under stress.
Now, I know that you mentioned you were the first in Arizona to do peace shots. You were the first or one of the first to do Gainswave. Let's talk about like regenerative therapies and what you see. What's the mechanism behind Gainswave, PRP, and how has it been working for you?
Yeah. So the I like to always go back to, if we try to break down the root cause of ED, a small percentage is going to be the nervous system, and I say the nervous, it's going to be mental. I like to, here's my analogy of I like to use. I say my background is engineering. I was an aeronautical engineer before I went to med school,
Really?
and so I quickly learned that the body is a biologic machine. That's what we are, right? And as doctors, we're basically trained to be mechanics of the human body. How's it put together? What are the parts? What parts can go wrong? In what systems? And then we become troubleshooters, right? And we troubleshoot the machine, find out what's going on, and then what are our solutions? It's pretty simple when we break it down like that. So when I explain it to a patient, I explain it like this: your brain is a computer, your penis is a motor, and we've got to get a signal. Our input is visual, tactile, touch, or even sounds. A whisper in the ear can arouse us. The computer has to process that, right? So that's that mental aspect we've got to get through. And then we've got the wiring bundle as our spinal cord. And then finally we have to get that signal into the motor, which is our penis. So we're literally breaking it down. Input we're looking at is does the brain process the signal? And so what gets in the way of that, right? Stress gets in the way of that. Some medications can get in the way of that. Depression medications can sort of numb things down.
Well, would you say testosterone is also key to that, though? Or like if you have low testosterone?
Oh, you're right. So testosterone, this is my take on it. Maybe a part of it in mild erectile dysfunction. All things separate. If you're low on T, and we correct that and nothing else, many times we're going to get better morning erections, and certainly our libido is going to go up. But 9 times out of 10, it doesn't fix the underlying cause, which is either going to be plaque, something vascular, something in the nervous system, or possibly.
So that's where the motor has gook in the. Now we're talking about oil in the motor.
So when we check everything out and we know we're getting a signal, maybe we're getting a partial erection. Now we're looking at, okay, this is when I say, okay, now we're gonna check the motor. We're making sure, we hook up the electricity to it. Is it accepting the signal? Nitric oxide is a big part of that, as you know, is that nothing's happening without nitric oxide. And what we know is that we drop dramatically from age 20 to 65, from 100% down to around 15% production of nitric oxide. And that's the signaling molecule that drives vasodilation in not only the penis, but in blood vessels throughout the body. So I check for nitric oxide in everybody with a saliva strip, and we find out right out the chute if that's a piece amazing. Of the puzzle. So in everybody, I've had maybe 2 patients, and it was the wife of one patient who was there in the room. She wasn't low, and she was a vegetarian. So it was pretty interesting. So we check nitric oxide, we correct that, and now we're looking at vascular integrity. And yes, we can do Doppler, we can do ultrasound, we can find out that, but really it's the input from the patient on, okay, are you a diabetic? And if they're diabetic, they've had inflammation, and if they've had inflammation, they've likely got plaque. But inflammation also, as you know, an increased insulin prevents nitric oxide from forming. And so without nitric oxide, again, we don't get the erections that we want. So we got to get inflammation down. Have they been a smoker, right? More inflammation. Have they had long run uncontrolled hypertension, which ultimately is going to cause inflammation and plaque. And then lastly, the big one is long-term chronic stress. The chronic stress is a killer. We know that can cause heart attacks. But along the way, the small vessels in the penis are going to be affected before the large vessels in the heart. And so we can see that erectile dysfunction forms before the heart attack.
So you'll do a Doppler and actually see this?
No, I do use an ultrasound just for just for general blood flow. But again, really without doing some sort of biopsy to find out what's going on, it's very difficult to see, just how severe things are.
So when a guy's in their 40s and 50s and the blood vessels are running low, you'll do either the PRP or the Gainswave, and the PRP just goes in there and creates new blood vessels, or brings in tell me a little bit about how that works.
Yeah. So when I say that the PRP is classically, we know that as what we call the P shot, which is platelet-rich plasma injected into the penis. In historically, I've been doing this a while. I've hundreds of P shots and many, if not hundreds of the Gainswaves. The P shot with PRP, really, your best bet is with real mild erectile dysfunction. This is just in my opinion. It's not going to help, especially right out of the chute, somebody with severe erectile dysfunction. But mild ED, I get a lot of young guys in their 20s coming in. They read about the P shot. They see someone like Ben Greenfield or some of these guys, these biohackers talking about it, and they want to stay ahead of the curve. So works really well to keep the pipes open and flowing, and with mild ED in general. But anything beyond mild into the mild, moderate, and severe, we're going to need, number one is clean up the lifestyle, right? We got to get the blood sugars in check. We've got to get the hypertension in check. And then we stand a fighting chance with the acoustic wave or the Gainswave to remove what plaque that might be there, and then really nudge the body to grow new vessels.
This episode is brought to you by Gainswave. If you're a guy who is not achieving optimal performance in the bedroom, and you've tried the pills and you've tried the shots, and you're looking for an all-natural way to boost blood flow in the penis, Gainswave is evidence-based and proven. Go to Gainswave.com and find a provider near you. Okay, and then when guys do that, they see great results after 3 to 6 treatments.
Again, it all depends. And this is the biggest thing that I see. And look, there are other Gainswave providers. And as you know, I would more than anybody is there are other non-Gainswave acoustic wave companies cropping up out there, and they're making all sorts of promises, hard selling people who come into their clinic and making these promises. The bottom line is setting expectations with a patient that, look, if I cut myself today and I put a Band-Aid on it, I don't peel it off and it's healed miraculously tomorrow. The body takes a while to bring in all of the necessary things in the body to heal. And what we're asking the body to do is build new blood vessels. It doesn't happen overnight, right? We're asking the body to get in and remove the plaque that's in there. So this, depending on how much is going on, how severe it is, this can take weeks to months. So mild, we might see better morning erections maybe after 1 or 2 treatments, right? We're basically using the pump, we're getting the vessel stretched open, we're getting immediate better. But really, I would say upwards pushing 6 treatments is really where we start to see the magic happen to most people.
Are you doing anything with stem cells, exosomes, other types of regenerative medicines?
I am. I've done both stem cells as well as exosomes, and then also using, as you may be familiar with, also using
Orton's jelly, or
but with peptides is another growing area. Absolutely. So
I like the pun. It's another growing area. Sorry, I can't help myself. So the peptides, that's interesting. So you're taking exosomes or stem cells and you're mixing it with peptides and injecting the peptides right into the penis?
I wouldn't say that. I would say I use them independently.
Mhm.
I'm not sure that we're really allowed to mix things together as you mentioned, but there's
Or-
things, I'm sure you're familiar with PT 141, right?
Mhm.
I use that adjunctively.
And that's more of a
Um,
libido enhancer, isn't it? It's
well, it's a blood flow enhancer. And yes, the side effect is also libido enhancer also, but I use it adjunctively as a means to help increase blood flow to the penis, independent of pumping and everything else. So that does help. And yes, it does increase libido along the way. That's a sort of a side effect of it. It's FDA approved as a medication for women for low libido disorder, but
yeah.
for
It's
men,
also
it
used to
does.
help you get a nice little tan, isn't it?
Yeah, right.
Like
Well,
that was one of
yeah,
the
the
formaldehyde or
melanotan too,
melanotan.
certainly, and I think they've taken the erectile function out of that one. You don't get a tan if you use the PT 141. They're two separate things.
Well, let me ask you this. I saw the other day, I saw a troche. You put it under your tongue. And it's got oxytocin,
Mhm.
PT-141, and tadalafil. You take it daily.
Right
What
on.
are your what are your thoughts on that?
I've tried those out, tried them on myself, and the oxytocin is it's very subtle in general. So whether or
Mhm.
not that's helping anything, I haven't seen a whole lot of success with at least the right dosage of a sublingual PT-141 to help things
Mhm.
work. Right. I think that something gets lost in the absorption versus a subcutaneous injection.
Yeah, I tried every time I try PT-141, I get nauseous. I don't know
Yeah,
if that's
that's
normal.
classic normal side effect. Yeah, and flushing of the face.
That,
So
that's cool. So you wrote the book on ED. I bet Miss Lark must be very happy on that. Like
right, Heidi, Mrs. Larke
Heidi,
is
yes.
happy. She was it's interesting is that she's listened to me for years talk about all this all these things floating around in my head and really getting them organized for someone who needs a nice reliable source to read. And so it really worked out well. So she was the driving force to say, okay, you're going
Mhm.
to sit down and you're going to put this thing together. So I really gave her a big portion of the credit at the end of the book. But interesting enough is the book isn't just written for men. I wrote this for spouses and significant others. In the first chapter, I talk about, like, why are you even reading this book? And you in some of the things that I talk about is you may have heard this. Oh, you don't love me anymore? Are you having an affair? You don't find me attractive? Because when a man can get an erection, women internalize it. They take it on
Blame themselves.
themselves, and there's got to be something wrong with them. Whereas 90% of the time, it is biologic. It's mechanical. There's something going on. But women, they internalize this and they take it very personal. So that's a big part of this. So I wrote the front end of this for women so they could understand that this is a not necessarily normal, but this does happen as we age as a result of wear and tear on the body.
I bet when you have a woman calling you saying, "Hey, I want to bring my husband in there," it's a done deal. Like
Yes, right. And I love it. I encourage couples to come in, and here's why. Like I talked about earlier, it's incredibly uncomfortable for a man to be there, talking about something as intimate as this. And that's when I got into this business of working in men's wellness. I realized that there was a shortage of doctors who would take the time and have the care and compassion to really help men be comfortable in that setting and be able to ask the right questions to get to the root cause. And so what happens is, if a guy comes in alone, you're having an out-of-body experience that you're even in a doctor's office talking about your erections to start with. And we end up with selective hearing. And when the spouse or girlfriend comes in, I get two sets of ears processing the data so that when they leave there and he says, no, he said this. And she's like, no, that's not what he says. He said this. they can put the pieces together and remember what I was talking about, and come up with a collective decision on what they want to do.
Any thoughts on branching out and starting to treat women when they come in?
You know what? Early on, I was trained in the O shot, which goes hand in hand with the P shot with Dr. Runnels, and I did that. You know what? Yes, I thought about that. My wife, who actually is my business partner and works in the clinic with me, we've talked about that. It's such an intimate thing for women, and yes, I could do that. My forte is men right now, so I see women. I see a number of women who, when the men come in and they get such great results, they're like, "Hey, do you do women's hormones? Hey, you help me with my GI. Can my wife come in and get food sensitivity testing?" So that's happening. But as far as getting into the the women's sexual aspect, I'm going to leave that up to others to work on.
And what's next for you, doctor? Like what excites you? What do you think's the next big thing?
You know what? I have I've come across some new / old technologies that might enhance what I'm doing right now that I'm really excited about. It's not something that I'm at liberty to necessarily talk about, but I think there are some things out there that are next generation wellness and treatments for what we're talking about that I'm running some experimentation on right now. So
love to hear more when you're ready. That's exciting.
Absolutely. Yeah.
Well, I appreciate your time, and this is great. This is really good. So if somebody wants to learn more, your website is thrivemed.com.
That's the one, thrivemed.com. We're here in the Phoenix area.
Do you do any telehealth if somebody's not local?
I do.
Or...
Yep. I've done when the book came out, suddenly I was doing consultations all over the country. So it's really been a nice boon for that. So, and then by the way, the book now is out on audio, on Audible, iTunes.
Did you do the narration for that?
I did.
That's really cool.
Yeah. Yeah. So turns out that one of my patients is an audio engineer at a radio station, and he helped me walk me through the whole thing. So it worked out pretty well.
That's exciting. Well, I appreciate the time. This is great. It's always good to hear a doctor's just so passionate about what they do. And the fact that you actually put a book out there, definitely check out the book. It's the MAM plan. You can get it on Amazon. We'll have links to the website in our show notes. I really appreciate your time.
Thanks so much, Mark. I appreciate you having me, and we'll talk soon.